There are currently 18 cases of coronavirus in Victoria, with 8 new cases notified yesterday, the 31st of December, including those that we reported late yesterday afternoon. Of these 18, 9 are locally acquired. This is the increase of 5, which were the cases that we indicated yesterday afternoon. There are 9 cases in hotel quarantining, an increase of 3 since yesterday. There's been a total of 3,889,001 test results during the course of the pandemic. That's an increase of 13,108 since yesterday. I want to thank all of those Victorians for getting tested. It is the most important thing you can do, and I would urge anyone who has even the slightest symptoms to come forward and get tested. And of course, we'll touch on the obligations that an increasing number of Victorians have to become tested in a minute. It's great to see these strong testing numbers because, as we know, testing is really what keeps us all safe. We again ask anyone who has been to any of the exposure sites listed to come forward and to get tested today. I'll ask Jerome to provide an update in more detail on the testing figures, the exposure sites, and the positive detection of wastewater for coronavirus found at Lakes Entrance on the 29th of December. From that update that we gave you yesterday afternoon, a further 2 results have been received from travellers who returned from New South Wales, which are negative, and we are still waiting on test results from a traveller who returned from New South Wales who is a close contact of a confirmed case. The New South Wales link is still our primary line of investigation for this outbreak. We expect genomic testing to come through very shortly and to assist us in confirming the lines of inquiry for our investigation. As soon as this genomic testing is available, we'll provide the update to the Victorian community. We've seen reports overnight of long lines at border entrances, and we've seen Victorians understandably frustrated by that. Our hard-working Victoria Police and SES volunteers are working as hard as they can to move people through these border checkpoints as quickly and as safely as possible. We ask all motorists to be prepared for delays again and to be patient. And just to reaffirm that from 11:59 p.m. tonight, the New South Wales border will be closed. Our message really hasn't changed over the last 2 weeks. I stood here some time ago and said, reconsider going to New South Wales. Don't go to Sydney. Reconsider going to New South Wales because the border can change quickly on the basis of public health advice. And we saw that happen yesterday. And today, I say, if you are returning to Victoria as of today, you must get tested and you must isolate for 14 days. For those border communities, we thank you for your patience and in what has been a very difficult 12-month period for those communities. For now, the border bubble will remain as it is. The review that is being conducted by the Cross-Border Commissioner will take a few more days, and when that's finalised as to what the implications are for border communities, we will of course have more to say. And just to reiterate that from 5 p.m. yesterday, our rules for mandatory mask wearing came in, and I can confirm as part of this that for those Victorians undertaking beauty services in coming days, you must wear your mask in all indoor spaces. However, masks can be removed if you are receiving a service where it is not practical for you to receive that service whilst wearing a mask. For example, if you're receiving a facial. And then for gyms, it's the same rule. You must wear your mask in all indoor public spaces. However, if you are engaged in any indoor strenuous physical activity in that gym, you can remove your mask, for example, jogging, running, cycling or spin classes. I'll ask Jerome to add to my comments and then we're happy to take your questions.